JCAHO and JCI, National American University, Sherry Malone. The benefits of accreditation to patients and healthcare organizations is that those organizations have a high standard of care. The organization has proven it has the capability to provide positive outcomes for those being treated. They have learned through the accreditation process and audits from other accredited organizations to continue improvements. Being accredited draws a competitive atmosphere among other accredited organizations, which ultimately helps to improve the organization. Accreditation draws companies to that organization to do business with, as one would do well to have a client that meets such high standards. To seek care from an accredited facility allows one to know that their health and safety, along with those who provide care, are foremost to the organization. JCAHO provides the sought-after gold standard in healthcare facilities in the U.S., while JCI provides the gold standard that the global community seeks, especially those who seek medical tourism as a means for treatment. The Joint Commission standards are based on evaluating an organization and provide the guidance needed to enhance functions of an organization. The Joint Commission relies on information from many areas, including healthcare experts and customers, to provide quantitative and qualitative measurable data that affect patients' care and safety while meeting or even surpassing the current criteria in place. The JCI, while the standards are obtained in much the same manner as the JCAHO, the decided difference is that the data and decisions are based on information gathered from many different countries. The data is still gathered and presented by experts across different areas of accredited organizations and healthcare leaders. JCI is quickly becoming the standard that is sought globally to meet the standards that have been set by the Joint Commission. Some ways the Joint Commission has made an effect on patient health in the U.S. are standards such as identifying patients before administering medicines or surgical procedures, controlling infections in patients, develop policy and procedures, evaluate patient satisfaction, increase positive patient outcomes. The JCI's effect on global health is to set standards that are consistent in all countries that are represented, to improve patient outcomes with these standards such as uniform quality of care, uniform policies and procedures, and they also set standards for academic medical centers for high standards of education. These are consistent with the Joint Commission's practices here in the U.S.